We as a nation are battling our worst health crisis, but there is a glimmer of hope that we'd like to put out for you this morning with regards to the COVID fight. The data that we're putting out suggests that the infection rate in India is at this point slowing down. The data on your screens of a reduction in R value below 1, which indicates that the infection is likely to spread slower than before. As we speak, data shows that India's R value has dropped to 0.98. It was at 1.08 on March 5th, climbed to 1.56 in the third week of April. It's been gradually coming down since then. The R value that indicates the number of people that one COVID positive person can pass on the infection to has been below 1 in states like Maharashtra, Delhi and Uttar Pradesh. So even as all of us in the age group of 18 to 44 years wait to get vaccinated because stocks are running low, those who've already got their first Covishield jab will now have to wait for 12 to 16 weeks for their second dose. And that's what the government panel on immunization has recommended. It's also suggested that those who've recovered from COVID wait 6 months before getting jabbed. So are these new rules really triggered by science, or is it because of a shortage, a lack of vaccines?
A drive in disarray.
मैं 8 बजे से खड़ी हूँ. मेरी मम्मी का सेकेंड डोज है कोवैक्सीन का.
एकदम कैओस है, कोई पुलिस नहीं है, कुछ नहीं है, कोई भी मतलब एकदम मिसमैनेजमेंट.
Shortage of shots in the face of surging infections.
9 बजे से लेके 1 बजे तक का स्लॉट भी दिया है. 9 से लेके 11 बजे तक अंदर एंट्री नहीं दे रहे, जबकि जगह ताला लगा के रखा है.
At least more than 95 crore people form the adult population base in India. But as per the government estimates, we were supposed to inoculate 30 crore people by July this year. India has only done about 1/3 of the population that is above the age of 45. It seems that the targets have been missed by miles, and even with foreign vaccines and their imports, it's still going to take some time to inoculate the maximum population in the country against the coronavirus.
A country that exported 66 million doses of made-in-India COVID vaccines till mid-April is now seeking to import the jabs to fully inoculate its own population.
आज कोई भी वैक्सीन जो FDA अप्रूव्ड है, WHO से अप्रूव्ड है, इंडिया में आ सकता है. उनको इंपोर्ट लाइसेंस चाहिए, वो 2 दिन में मिलेगा, 1 दिन में भी मिलेगा, कुछ है ही नहीं उसमें.
A dozen states are now considering global tenders for COVID vaccines. Till now, India approved Serum Institute's Covishield and Bharat Biotech's domestically developed Covaxin. Russia's Sputnik V is also cleared for emergency use. The central government is now easing the rules to pave the way for others.
Pfizer, Moderna, J&J के साथ शुरू से टच में है, ongoing. हमेशा पूछा, फॉर्मली पूछा, बातचीत करी कि प्लीज वुड यू लाइक टू सेंड डोजेस टू इंडिया, प्लीज वुड यू लाइक टू मैन्युफैक्चर इन इंडिया, वी विल फाइंड पार्टनर्स, वी विल असिस्ट यू. उन्होंने कहा कि अभी हम अपने तरीके से चले हैं और वैक्सीन अवेलेबिलिटी जो है वो Q3 में बात करेंगे. 21 इस Q3 में देखते हैं जो अवेलेबिलिटी होगी.
The central government has also told the Supreme Court that vaccine manufacturing of Covishield, Covaxin and Sputnik V would be ramped up in the country by July. Hit hard by the pandemic, Maharashtra has announced plans to bid for imports.
ग्लोबल टेंडर्स फ्लोट करना हर कोई ऑर्गेनाइजेशन का अधिकार होता है. अगर बीएमसी ने किया है तो निश्चित तौर पर कुछ अच्छे पर्पस के लिए ही, अच्छे ऑब्जेक्टिव के लिए ही किया है. तो WHO ने पास करने के बाद सिर्फ हमारे इंडिया में यूज़ करना है या नहीं करना है, इसके बारे में गवर्नमेंट ऑफ इंडिया की सिर्फ एक फॉर्मल परमिशन चाहिए होती है.
The city of Mumbai meantime floated global tenders for 10 million doses. The procurement is estimated at rupees 400 crore. Down south in Tamil Nadu, the new government has emphasized the need for imports.
The state government had a high-profile meeting in which they've decided that a global tender will be called for, wherein they will be trying to procure sufficient amount of vaccines globally and ensure that 18 to 45 age group will also start getting their vaccination done.
Battling the ferocious wave, Karnataka too is looking at global bids.
Definitely we are trying to negotiate, to connect. Wherever we can get the vaccines readily, we are trying to mobilize and ensure that whatever might be the demand, we are trying to comply with the demand and ensure everybody gets the vaccine.
Similar moves are being pursued by Haryana up in the north, and also by Rajasthan for import of 1 crore vaccines. With Akshay Anath in Chennai and Milan Sharma in Delhi, Bureau Report, India Today.
Now, in the midst of this COVID crisis, the Central Vista project in the national capital is going on full steam. The opposition has latched onto this. They've slammed the centre, asking what's the urgency over this project. The matter has now reached the courts as well. Here's the latest.
A country ravaged by the pandemic, where citizens run from pillar to post for oxygen, medicines, hospitals, and even a spot for funerals. In the middle of this mammoth health crisis, the construction of the Central Vista project has become a simmering flashpoint. Apart from very divided public opinion, it has given the opposition major ammunition to attack the Modi government's priorities.
3.5 लाख 4 लाख लोग रोज बाधित हो रहे हैं, 4,200 से अधिक लोगों की मृत्यु हो रही है। देश में इलाज की सुविधा पूरी तरह से नहीं है और ऐसे समय में 20,000 करोड़ रुपए खर्च करना ये उचित नहीं है और केंद्र सरकार को चाहिए, मोदी जी को, कि तत्काल रूप से इस कार्यक्रम को स्थगित करें और वो पैसा जनहित के अंदर खर्च करने का काम करें।
To counter the narrative, BJP President JP Nadda has taken on opposition, questioning why Congress-ruled states haven't stopped multi-crore projects currently going on in full swing. Now, Congress-ruled Chhattisgarh government has halted construction work of new Raj Bhavan, the Assembly House, the CM House, and new houses for ministers, putting the ball back in centre's court.
Universal mass vaccination program is the only answer. That has to be undertaken. We have made provisions in the budget of 35,000 crores for this purpose. Stop this vanity constructions in Delhi and transfer that money for this purpose.
ये एक अप्रत्याशित संकट है। इस संकट के समाधान की दिशा में सबको मिलकर के आगे हाथ बढ़ाना चाहिए और जुटना चाहिए। लेकिन ये लोग तय कर चुके हैं कि हम भय और भ्रम का भौकाल खड़ा करेंगे, इससे ज्यादा कुछ नहीं। तो ये उनकी अपनी समस्या है।
With the rise in cases, the blame game over the pandemic is only gaining momentum. A plea in Delhi High Court seeking an interim stay on the ongoing construction of Central Vista could not be heard on Thursday. Centre in court has sought that the plea must be quashed with exemplary costs.
2 letters within 2 weeks. Victories in the recent assembly polls has charged up the opposition parties to take on the might of Modi government. Opposition party leaders are seeing an opportunity amid crisis as COVID continues to wreak havoc. The previous one yielded no response from the Modi government. Will there be a prompt reply this time around? Well, it is tough to guess. This is Anand Patel in New Delhi for India Today.
And we've been getting you several reports of how COVID has been ravaging rural India. We visited the Firozabad Medical College in Uttar Pradesh, where the COVID ward is mostly run by doctors who are under 30. Preeti Chaudhary gets you this story of the overburdened healthcare workers in this area.
Let's begin with the cliche. Some heroes wear capes while others wear PPE kits. The hardships of the frontline workers in big cities is well documented this pandemic. We now bring you their stories from Little India, small towns battling the virus. Firozabad Medical College in Uttar Pradesh, a 100-bedded COVID hospital. Its COVID wards manned and mostly run by those under 30. Meet them. Know them. Dr. Himanshu. He's coming down now from the wards to give a blood sample.
10 डे बिफोर की मैं बात करूं तो उसके अकॉर्डिंग अभी थोड़ा सा प्रेशर कम है, बट ये नहीं बोलूँगा कि प्रेशर बिल्कुल ही नहीं है। नंबर ऑफ पेशेंट्स 10 दिन पहले बहुत ज़्यादा थे और बहुत ज़्यादा प्रेशर था। अभी पहले से थोड़ा सा कम है, बट अभी भी पेशेंट क्रिटिकल हैं, तो प्रेशर तो अभी भी बना ही हुआ है। यस, नाइट में मैं 12:30 के समथिंग यहाँ से रिलीज़ होता हूँ। उसके बाद मैं रूम पे जाके अपना नहाना है, नहाने के बाद खाना खाते हैं, फिर सो जाते हैं। मॉर्निंग में उठने के बाद वही अपना ब्रेकफास्ट लिया 1 o'clock 2 o'clock समथिंग, फिर लंच करने के बाद में यहाँ पे आके किट पहन के अंदर, उसके बाद में वही रात को फिर 12 बजे। यस।
खुद डर लगता है आपको कभी?
जब फर्स्ट टाइम मैंने ड्यूटी, जब अप्रैल 2020 में जब मैंने ड्यूटी ज्वाइन की थी, जब मेरे को जरूर डर लग रहा था कि पता नहीं क्या होगा क्या नहीं होगा, लेकिन जब से तो पेशेंट हम टैकल कर ही रहे हैं, तो अब पहले सब प्रायोरिटी ये है कि बस पहले पेशेंट सही हो जाए। और अभी तो ये है कि बस अब हमसे ज़्यादा डर हमारे पेरेंट्स डरते हैं कि यस, बट पेरेंट्स कहते हैं बेटा सेफ रहो, अब मतलब पेशेंट का ध्यान रख रहे हो, उसके साथ में अपना भी ध्यान रखना अच्छे से। अभी जो मेरा एक्सपीरियंस बोल रहा है कि पेशेंट को मेडिसिन के साथ में सबसे ज़्यादा काउंसलिंग की और मोटिवेशन की ज़रूरत है। हाँ, मैं हर पेशेंट के पास जाके उसको मोटिवेट कर रहा हूँ कि आप घबराइए नहीं, आप जितना ज़्यादा परेशान होंगे, जितना ज़्यादा सोचेंगे, उतनी ज़्यादा परेशानी बढ़ेगी और उससे पेशेंट को रिलीफ भी मिलता है।
Meet the man behind the PPE kit. 28-year-old Dr. Himanshu. Dr. Himanshu, who ends up being a psychologist to many twice his age. His friend Dr. Ratul has just returned from a 9-hour shift.
मेरी ड्यूटी रहती है 11 बजे से सुबह 7 बजे तक, 8 घंटे की कंटिन्यूस ड्यूटी रहती है, जिसमें हमें हर पेशेंट्स के से जाके पर्टिकुलर पूछना होता है कि उनकी कंडीशन क्या है क्या नहीं है, उनके वाइटल्स देखना, उनका ट्रीटमेंट देखना, वेदर दे आर गेटिंग प्रॉपर ट्रीटमेंट और नॉट, और उनका प्रॉपर फॉलोअप रखना। उसके अलावा अगर उनकी कोई इश्यूज होते हैं, अगर उनकी कोई कंप्लेन होती है, उनका सॉर्ट आउट करना। हमारे जो कंट्रोल रूम है वहाँ से हम हर टाइम पर कोऑर्डिनेट तरीके से काम करते हैं। डिपेंडिंग ऑन अगर कभी पेशेंट डिटेरियोरेट कर गया, अगर बाई चांस भगवान अगर पेशेंट डिसीज भी कर जाता है या पेशेंट डिटेरियोरेट ज़्यादा कर रहा है, हमें उसको एट द स्पॉट पूरा ट्रीटमेंट देना, फिर हमारे जो सीनियर्स हैं उनको कंसल्ट करना, बाकी और दूसरे डिपार्टमेंट के जो रेस्पेक्टिव डॉक्टर्स हैं उनको कॉल करना। इसकी भी उन सब सारी चीज़ों के ऊपर डिपेंड करता है कि हमें टाइम कितना लग सकता है। इट इज़ नॉट नेसेसरी कि 8 घंटे भी 9 घंटे भी हो सकते हैं, और रुका रहना पड़ सकता है जब तक कि दूसरी शिफ्ट शुरू ना हो जाए, दूसरे डॉक्टर्स ना आ जाए।
Dr. Shipra is a physiotherapist here. Unlike her colleagues who spend up to 10 hours in their PPE kits in one go, her time is flexible.
लास्ट ईयर भी किया था।
जब शुरू किया था तब तो लगा होगा।
हाँ, तब पहले टाइम बहुत थोड़ा डर था, लेकिन अभी बिल्कुल डर नहीं है। अगर हम लोग डरेंगे तो फिर पेशेंट कैसे ट्रीट करेंगे?
ठीक कह रहे हैं, पर आप क्योंकि फिजियोथेरेपिस्ट हैं तो और कोविड पेशेंट्स हैं लार्जली, उनको जो चेस्ट में बहुत ज़्यादा होता होगा, तो
कंजेशंस बहुत रहता है उनको चेस्ट में,
इसलिए आपको ज़्यादा वर्क करना पड़ता है।
हाँ।
कैसे मतलब इनका अलग होता है क्या फिजियोथेरेपी जो कोविड पेशेंट्स होते हैं?
हाँ, थोड़ा सा डिफरेंट रहता है हम लोगों का। जैसे कि हम लोग जैसे उनको चेस्ट पीटी देते हैं सुपाइन में, मतलब सीधा उल्टा और लिटा कर, जैसे भी पेशेंट कंफर्ट फील करता है वैसे ही हम लोग उनको चेस्ट थेरेपी देते हैं। उसके बाद में हम लोग उनको ब्रीथिंग एक्सरसाइज बताते हैं। नाक से सांस लेना है, मुंह से छोड़ना है, जितनी गहरी ले सकते हो आप उतनी गहरी सांस लेनी है। ये सब हम उनको गाइड करते हैं, जिससे कि उनका लंग्स अच्छे से अच्छे जल्दी इम्प्रूव हो। वो थोड़ा सा मतलब कि इमोशन भी आता है, पता नहीं हम लोग घर जाएंगे या नहीं जा पाएंगे, तो हम उनको समझाते हैं कि नहीं, आप थोड़ा हिम्मत रखो अपने आप में, विल पावर अपनी इम्प्रूव करिए, जिससे कि आप जल्दी से जल्दी अपना घर जा पाएं।
As we continue to detail stories of suffering, it is but so important to tell the stories of those who are in the front line, witnessing that suffering. and doing what they can as doctors. Reporting with camera person Hitesh Kumar, Preeti Chaudhary for India Today.
As parents await vaccines for their kids, there is a big worry. Experts have warned that if there's a third wave of coronavirus, it will be children who are going to be most vulnerable. Here are the details.
Even as India battles a second coronavirus wave, the threat of a third wave looms large. And experts say that it will be children who will be most vulnerable. Already, several children below the age of 18 years and newborns are now testing positive for COVID-19. States like Maharashtra have already set up a special pediatric task force in anticipation of the third wave that will procure medicines, ventilators, and build COVID care centers for children. The World Health Organization, however, says there is no evidence that the third wave will impact kids.
Children, we've seen from the beginning that while they can get infected, especially children under 10 are usually asymptomatic, usually not picked up and don't get sick. And it's very rare serious events that we see in children who are infected. You know, the multi-organ inflammatory syndrome, it's a very rare complication.
While the COVID threat for children does exist, the only solution, the vaccine, seems to be a long way off. The government's expert panel has cleared phase 2 and 3 trial of Bharat Biotech's Covaxin on children between the ages of 2 to 18 years. Pfizer-BioNTech vaccine has been approved by the US FDA for 12 to 18-year-olds. American President Joe Biden has asked for immediate vaccination of young teens. Moderna is also conducting KidCo vaccine study for kids aged 6 months to 12 years. One thing is for certain, we need to protect our children and do so fast. Bureau Report, India Today.
Even amid truce efforts, Israel and the Hamas conflict shows no sign at this point of dying down. On one hand, Hamas continues to launch a barrage of rockets towards Tel Aviv. Israel is retaliating with much more force. Here's the latest updates on this.
Hamas militants firing one barrage of rockets after another into Israel, targeting civilian areas for the fourth straight day in a sign of escalation of tension and violence along the Gaza Strip. Hamas fired more than 1,600 rockets into Israel, which has resulted in the loss of 7 lives and several injuries. Several Israeli citizens have been forced to rush to bomb shelters, and the Iron Dome rocket defense system has been in action almost continuously, destroying incoming rockets in the air. Israeli security forces hit back, launching a number of airstrikes into the Gaza Strip. Israeli security forces have called it a complex and first-of-its-kind operation, taking out the Hamas leadership and launch pads with pinpoint accuracy.
It's unfortunately escalating, and we have been trying for quite a while to de-escalate the situation. This didn't start today. You know, it started several days ago, and we were trying in Jerusalem. It started in Jerusalem, and we were trying to de-escalate the situation there. But Hamas has determined that it will stir things up and it will make trouble. It's trying to get control of the Palestinian Authority, and this is its way to do it.
The administration on the Gaza Strip claimed 83 lives had been lost, including 17 children in the Israeli airstrikes. More than 480 civilians are said to have been injured. The Israeli Air Force brought down a 6-story residential building in the heart of the Gaza Strip, claiming that the building housed top leadership of Hamas, including its security and intelligence chiefs. Israel also claimed that sufficient time had been given to residents to clear out before the building was taken out. Israel has used precision-guided munitions to target specific buildings in its airstrikes. In a sign of escalating tensions, Israel has now massed thousands of troops, tanks and armored vehicles close to the border with Gaza. Both the United Nations and the United States are closely monitoring the situation and have called for a reduction in tensions. But given the strong statements from both sides, the tension and conflict are only set to escalate.